Network. This is Inside Politics.
Hello, everyone. I'm NewsChannel 5's political analyst, Pat Nolan. Welcome to Inside Politics. COVID-19, it's been the bane of this country, indeed the entire world's existence since the early months of 2020. Almost a year and a half later, where do we stand with a fourth wave of the virus, including the highly contagious Delta variant increasing across Tennessee and here in Nashville, as well as other states and communities, and especially those with low vaccination rates? What needs to be done to bring this pandemic finally under control? And is there any kind of time frame for when that might happen? To bring us his insights and wisdoms on these topics, we welcome back to Inside Politics the chair of the Metro Nashville Board of Health, Dr. Alex Jahangir. Doctor, thank you so much for joining us again.
Truly a pleasure. Thank you.
Just a few weeks ago, the city, everybody else across the country, lifting their mask-wearing mandates, other COVID restrictions. It looked like we were just about back to normal. What happened?
Well, viruses know one thing, and that's how do they go from person to person more effectively, and they try to get around any barriers we put for them. And for a while, we had a really successful barrier with the vaccines, and we got a really quick uptick in vaccines, but we slowed down as a community. And this virus evolved, and a new strain that I'm sure everyone's heard of called the Delta variant has now presented. And this Delta variant is a lot more easily spread. It's a lot very prominent, and now when there's half our population or more that doesn't have a vaccine, it goes around quickly, and that's the big difference now, and that's why we're seeing the numbers we're starting to see again.
Compared to July, what is Nashville at right now, or what are we looking at in terms of, is it going straight up on the chart?
Yeah,
in terms of cases, 7-day average, hospitalizations?
So on July 4th weekend, which was a great weekend, I went downtown, and we were at 440 active cases. So in the whole city of 700,000, 444 Nashvillians had COVID. Today we're just shy of 3,000. And we were, last time we were at this number was in August of last year. And these are numbers we saw again, April and August, and it's pretty aggressive. And so when it comes to hospitalizations, yeah, hospitals are getting full again. I think you may have seen that hospitals here in the state have now increased 7-fold in the number of people admitted with COVID patients from the beginning of the month to today. And we're starting to see more people die again. So yeah, our numbers are heading the wrong way. I didn't
ask you about deaths because deaths usually lag. Are we going to see an increase in Nashville and in this immediate area in deaths because we're just now beginning to see the spike on this end and the spike in deaths comes last?
Well, I think you will inevitably, unfortunately, see a spike in deaths. And like you said, about a week to 2 weeks, sometimes 3 weeks after the uptick. In Nashville, we have 951 Nashvillians who've lost their lives. And each one of them is really tough. So that leaves our mortality rate in Nashville just shy of 1%. The national average in the United States is about 1.8%. So we're still lagging a little bit in a good way from national deaths. But yeah, deaths will also follow what we're seeing.
Earlier this week, the state health commissioner, Dr. Lisa Percy, said that given the current trends of the virus in the state, that almost all the children's hospitals will be full. Now, to be fair, there's a lot of other viruses, I understand, that are directed to children or that are spiking as well that don't have anything necessarily directly to do with COVID. But we are seeing a situation where, at least in terms of pediatric beds, we're in trouble in Nashville and across the state.
Yeah, I had the opportunity to speak with the commissioner after I saw those remarks because that worries me as well. Here it is exactly as you said. The COVID hospitalizations are not what's causing pediatric beds to fill up. There's about 10 or so Nashville kids in the hospital right now with COVID. What you're really seeing are an increase in RSV, influenza, and other viruses that you usually don't see this early, but that is exactly right what you said.
Mayor Cooper instituted or reinstated a mask mandate in all metro buildings. Are we heading towards other mask mandates, perhaps for businesses? And if that happens, will Metro do that, or will that be done by businesses as it happened in some cases earlier last year?
Yeah, so I don't believe Metro government is going to instill a mask mandate anymore. And the reason is this. The purpose of mandates, whether it's mask mandates, business restrictions, and so forth, from a public health perspective, is to protect the public when there's not a safe, effective intervention available to protect somebody from the public health threat. Now, as a city and as a state and as a country, we have a very effective, safe, and easily accessible intervention, the vaccine. And so I know Mayor Cooper and I and Dr. Gil Wright, our Director of Health, all believe, and now that intervention is available, it wouldn't be appropriate for us to necessarily put in an intervention. Rather, businesses should take that lead if they want to follow CDC guidelines. And Mayor Cooper, by being the executive of the metro government and of overseeing the metro buildings, made that decision as an executive, as a model of how one can lead.
You mentioned not much concern on the 4th of July when the city had its big event downtown. We had the Garth Brooks concert, although that wasn't happening, but the virus was probably present over there last weekend before the concert was canceled. Now we have the Grand Prix downtown this weekend. Anything to be concerned about? If people are going, what precautions should they take, even though it's an outdoor event?
Sure, and I think this is what's so critical is people need to take responsibility for their actions. And so when you go into public, really crowded places, especially indoors, wearing masks are a great, safe way to protect yourself. More effectively, get vaccinated. Vaccines have been shown to be so effective. 98% of our deaths so far are unvaccinated. 97% of our hospitalizations are the unvaccinated. So the most effective thing one can do, get vaccinated. But when you're in large crowds, wear a mask. If you have young children, kids can't still be vaccinated. They should also wear masks. And I, for my kids, will model mask wearing in public when I'm with them for that purpose.
Dr. Fauci says it's going to get worse before it gets better. Then I read stories that say perhaps it will peak within the next month. That's a little confusing. Do you think it's going to peak here in Nashville within the next month?
I think if you look at how this virus trended, the Delta variant specifically in India, I'm hoping, Dr. Scott Gottlieb, the former FDA commissioner, also believes this will last about a month or so. But hopefully, I don't know. I hope it does peak out.
Dr. Alex Jahangir is our guest on Inside Politics. He's the chair of the Metro Health Board. He's been a leading proponent trying to fight the COVID-19 pandemic in Nashville. Back to continue our conversation with the doctor after you watch these messages.